we're joined by Dr. Raymond, who's well known to this audience, along with his colleague, Dr. Terri Darun-Cassini, and they're going to join us and talk a little bit about the work that I don't think a lot of people are familiar with in terms of the medical college, the role it has, and the work it does on violence prevention. So while we get the slides set up here, I think we're joined by both Dr. Raymond and Dr. Cassini.
Yeah, thanks, Tim. I'll kick it off. First of all, by thanking Peggy and also acknowledging the questions in the chat box about concerns about violence in the city of Milwaukee, which is really a good segue to the work that Dr. Darun-Cassini and her colleagues do. MCW's interest in violence prevention is twofold. First of all, violence has a direct and an indirect negative impact on the health and well-being of the people in the communities that we serve. Second of all, violence erodes the reputation and the vitality and the economic well-being of our region. And as a large employer that contributes to the vitality of the region, we also are concerned about that second aspect. So Tim, if it's okay with you, I'd like to introduce Dr. Darun-Cassini so she can talk a little bit about the great work that she and her colleagues do. Terri is a professor of surgery in the Division of Trauma and Acute Care Surgery at MCW. She's also the director of our longstanding Comprehensive Injury Research Center. She works collaboratively really across the region. The primary partners are Froedtert Hospital, Children's Wisconsin, the Clement J. Zablocki VA Medical Center, the city and the county of Milwaukee, and the state of Wisconsin. I think you'll be surprised to learn about the scope of the center that spans various aspects of violence and violence prevention, guns, alcohol, suicide, and post-trauma survivorship. And with that, I'd like to turn it over to Dr. Darun-Cassini.
Thank you, Dr. Raymond.
Thank you, Dr. Raymond. And I just want to say thank you. I'm excited to be here to talk with everybody about the Comprehensive Injury Center. If we could go to the next slide, please. Just want to orient everybody a bit to the Comprehensive Injury Center. As Dr. Raymond said, we've been around for a long time. It was started in the mid-1990s. And right now, we have 4 divisions of our Comprehensive Injury Center. The first one is suicide prevention, led by Sarah Kolbeck. The Division of Suicide Prevention is really focused on both not only preventing suicide, but preventing subsequent suicide after a suicide attempt, as well as providing support to loved ones who have lost someone to suicide. In this work, Sarah and her colleagues have created the very first Milwaukee County Suicide Review Commission, where monthly they review suicide deaths that occur in the county and utilize the information that they glean from those reviews in order to move forward with suicide prevention initiatives. She also created our center's very first podcast called The S Word. And every month she and Dr. Andrew Schramm, one of our other faculty, host this podcast and have guests that span survivors of suicide loss to researchers that are researching the effects or how to prevent suicide, to clinicians who care for those who are at risk of suicide. So I highly encourage you to check out that podcast if you haven't. I know it has significantly impacted many who suicide has an impact on their lives. We also have our Division of Violence Prevention led by Reggie Moore. Our Violence Prevention Division has experienced a significant amount of growth over the last year as we try to address violence, not just in Milwaukee and southeastern Wisconsin, but across the state of Wisconsin. We house the 4 and 4 Life program, which has a community and a hospital component to it. The community component is focused on neighborhoods where violence is clustering the most, to engage in violence interruption and outreach to change social norms related to violence and the use of violence and conflict resolution. We also have a hospital component of the program where individual violence interrupters respond to survivors of gun violence who come to our level 1 trauma center and talk about non-retaliation and talk about safety, as well as connecting survivors with resources to try to affect their trajectory of recovery in a positive way. Since we've started this program, our Level 1 Trauma Center in the Division of Trauma and Acute Care Surgery has also started our Trauma Quality of Life Clinic, which is designed as a multidisciplinary integrative clinic to provide care to gun violence survivors to increase access to specialty care like mental health, as well as to provide them with allocation of resources and connect them with resources in the community for better recovery. We've also received in our center ARPA funding to create the statewide violence prevention granting program, and that actually got released yesterday. And we're taking applications across the state for organizations to apply for violence prevention funds to engage in additional programming or to pivot programming in order to address violence in their communities. We have our Division of Data Surveillance and Informatics, which is led by Dr. Connie Kostelak, who is an assistant professor here at MCW. Some of the many things that she does, I just want to highlight the VR FAST program. I feel like this is one of the best kept secrets, unfortunately, although many of you may have seen this in the Milwaukee Journal Sentinel article last week about the VR FAST program. It is one of the most highly collaborative group of individuals that spans law enforcement, the fire department, our institution and the Comprehensive Injury Center, the criminal justice system, the county, the city, and where they meet weekly to address trends in violence and also pivot efforts and share information as necessary to try to prevent further violence. And it's a highly collaborative effort, and it was recently funded by federal dollars in order to keep the efforts going. She also leads data evaluation related to opioid overdose in our region. We also have our Division of Data Surveillance and Informatics, our Division of Injury Science led by Dr. Mike McRae. And our Division of Injury Science is really focused on helping to facilitate research in our campus and across the city at the different academic institutions to make sure that we're collaborating and really putting forward the most innovative injury science and community engaged research that we can. And together we will be working on applying for CDC center funding over this next year to be recognized as a CDC Injury Prevention Center. And lastly, I'll say that we have the Wisconsin Alcohol Policy Project, which is a policy project that is funded by DHS to address overconsumption of alcohol and how that relates to rates and incidents of injury, as well as negative health outcomes. And that is led by one of our public health experts, Maureen Busalaki. So in addition to being the director of the Comprehensive Injury Center, I'm actually a trained clinical psychologist and the medical director for the trauma psychology program at Frederick Hospital and MCW, where we provide psychological care to survivors of trauma in the hospital. Many of us who work in trauma see the daily human suffering for those that have experienced gun violence and their families, as well as those whose loved ones did not survive their gun violence related injuries. And so the human toll is high, and that human toll also can take a societal toll or economic toll. So if we could go to the next slide, please. Recently, the Everytown Research for Gun Safety published the economic toll of gun violence. And I think it's just really important for us to think about the human suffering that takes place in response to gun violence, as well as the toll that has on our society, as I mentioned previously. And a couple of things that I want to highlight, that there's about a $557 billion annual national toll of gun violence. And Wisconsin is not immune to that, unfortunately. So what it translates to is about $12 billion of taxpayer funds going towards addressing issues related to gun violence. And that looks like things like emergency transport, Social Security insurance, Medicaid, mental health care, and so on. In addition to the cost of investigating the incidents and prosecuting those who were responsible for crime. And so it has a significant economic toll and also has a toll on our hospitals. There was an analysis done about 4 years ago that shows that for every gun violence survivor that's treated at a hospital in Wisconsin, it costs about $76,000. Next slide, please. So there's those direct costs of gun violence, but there's also those indirect costs. And those are a bit harder to capture, but the researchers at Everytown evaluated work loss costs. So when an individual is involved, whether as a perpetrator or a survivor in gun violence, the loss of the potential for them, their work life loss, as well as the impact that has on their loved ones who in turn have to care for them and have also an economic loss in having to care for their loved ones. And it also translates to a lost quality of life. If you have ever known someone to survive gun violence and what it takes to kind of move through the suffering and really try to recover, it takes a significant toll, and it's really intangible, but it's really the pain and loss that victims and survivors face as they try to restore their lives back to normal. And oftentimes many of them struggle to do that. So I will leave it there. And I think we'll turn it over back to Tim.
Sure, Terri, maybe a couple of questions for you. Really focusing on the violence prevention part of the mission that you have here. Mm-hmm. And, you know, I've been around long enough. I've seen so many press conferences where somebody says, this is enough, it has to stop. And as you know so well, so much of the violence in this city and other cities is between individuals who know each other. It is. There's a relationship, something's happened that's triggered that. How do you go about, or how do we go about addressing that, and then B, measuring the impact of some of the interventions that the medical college is engaged in?
Right. No, those are great questions, Tim. And absolutely, we're talking about really changing social norms, right? And so that doesn't happen overnight. We want individuals, and this is part of the work of our violence interruption team, we want individuals to not respond to conflict with an immediate response of violence. We want to help them learn different ways of solving conflict. And that's really what our violence interruption team does. And to shift those social norms takes some time. The Form for Life program, for example, if we're talking about that program, uses something called the Cure Violence model. And adjusting those social norms within community groups is one of the largest well-established outcomes of the Cure Violence program. We've only had the Form for Life program in Milwaukee for a little over 3 years. And so as we see change and we see individuals making different choices in relation to resolving conflict, we know that it's going to continue to take repeated role modeling, if you will, and repeated coaching. And that's really a big piece of the violence intervention program.
You know, so it's hard to measure violence that doesn't happen, I guess is what I'm saying. So how do people get a sense that, you know, we're gaining on the challenge? And I realize this just doesn't sit with MCW, but from your perspective and what you're doing, how do people get a sense that we're making progress when it comes to that?
Yeah, you bring up such a good point, Tim. Showing that something was done to prevent something from happening is a bit difficult. And so the things that we do is we track the number of actual interruptions that the team does. And so we've noted that they have interrupted on well over 100 potentially or highly conflictual events. So we track those situations and not just track the interruption that happened in the moment, but also the ongoing engagement with the different individuals that were a part of that conflict to make sure that, you know, some sort of retaliation or violence doesn't ensue a year later, for example. So again, the program hasn't been around for a long time, but those are the types of things that we're doing to follow how well that interruption kind of lasted in changing these social norms. Another thing that we do, for example, on the hospital side, is we track the number of times that an individual meets with one of our violence interrupters, what is discussed in a general sense. And we have different categories now. We know that the main topics of what people are talking about. And then the other thing is, in order for us to address violence, we have to address social determinants of health. And so really making sure that we're not just helping people change the way they resolve conflict, but also helping them to make sure they have the things that they need on a daily basis to live the best quality of life that they can. So connecting them with employment, for example, connecting them with safe housing, for example, and safe, stable housing. So working with other entities in the city and the county to make sure that those resources are available and we're making the best possible connections, because that has implications for reducing violence just as much as the violence interruption itself.
So what is Milwaukee doing that's working? And what do we need to do more of, or what are we doing, or what aren't we doing that you think we should be doing?
Yeah, I think a couple of things. While we really, both in the city of Milwaukee and across the country, we really need to be thinking about preventing violence from happening in addition to responding to violence. And that really takes a public health approach to violence prevention as well as law enforcement. And I will say actually that what we are doing really well is collaborating with MPD in the sense that, and I'm talking more broadly across our division of violence prevention, our division of suicide prevention, and particularly centered in this VR FAST program. I really think our VR FAST program is going to lead the way for other cities across the country to look at how do different sectors of the community who are invested in reducing violence work together in order to, over time, really reduce the incidence of violence that we're seeing. So actually, I think we're leading the way as far as that goes. You had another part of the question, Tim, and I can't recall what it was.
No, I think kind of what Milwaukee's not doing enough of and what it needs to do more of.
Yeah, I would say what we're not doing enough of is, I think, everybody wants to see our violence, our homicide rates, our non-fatal shooting rates go down and go down instantly. And it's just not, it doesn't happen like that. It grew gradually. Prior to the pandemic, we actually saw a year over year for 4-year decrease in violence. And the pandemic, unfortunately, presented with multiple challenges that I think everybody is trying to figure out and trying to figure out a way to address. And I think a big piece of that is that our violence is centered in our communities that are really overburdened and experiencing resource deprivation, poverty. And we, as much as we're addressing violence prevention, we really do, as I mentioned previously, need to be thinking about how do we invest in addressing social determinants of health that have really been centered in certain neighborhoods in our city for a while. Because if we get individuals access to employment, if we get individuals access to safe and stable housing, research and years of research has shown how that helps individuals also move away from experiencing violence, being exposed to violence, and using violence themselves as a way of conflict resolution.
Dr. Raymond, how do you think about the investment that MCW is making in the Thrive On Collaborative as a part of your outreach to impact the community?
Yeah, thank you for asking, Tim. And that really segues nicely from what Dr. Darun-Cassini said about addressing the social determinants of health. We are making a place-based investment where we're helping Royal Capital Group to renovate the iconic Gimbel Schuster department store. And we're going to move literally hundreds of our community-facing faculty, staff, and students into that building and co-locate with the Greater Milwaukee Foundation, which also has made a generational commitment to help neighborhoods find ways to build on their strengths and to address issues that have this really significant impact on health and on violence. So Terri talked about safe and stable homes, living wage jobs, stable educational opportunities, the ability for people to own homes and then pass that wealth that they generate from home ownership onto the next generation in their family. So MCW has made this 22-year commitment with a long-term lease in that building. And through partnership with the 3 neighborhoods, that Harambee, Halyard Park, and Brewers Hill, to be there and to be part of providing our talent, our resources, and quite honestly, our humility to try to be part of the solution.
Mm-hmm. Terri, you mentioned something that kind of struck me, that Milwaukee had been on a 4-year, year-over-year decline when it came to violence or homicides. What is the biggest factor that you saw through the pandemic that's really kind of turned that around, almost like a hockey stick?
Yeah, so this is the big conversation with experts nationally about, because it's not just in our city. This is across every major metropolitan area in the country. And I think it was, you have individuals who are in different situations. For example, we saw our domestic violence rates go up nationally, and part of the thought there is that individuals who were staying at home more and staying in close proximity to each other were more likely then to be injured by their abuser, for example. We saw kids, unfortunately, out of schools to try to protect them from COVID. And unfortunately, I think for some kids, they didn't have supervision in order to make sure that they were engaging in virtual school, and then they were getting in conflict with each other. And so I think, and then also, again, we have our communities that were already hit hard by the pandemic, and we saw the clustering of that within certain neighborhoods in Milwaukee for sure. And unfortunately, if you look at the maps of where violence is clustering, it's also clustering in those communities as well. And so I think the lack of resources, and you take individuals who are kind of barely making it, and then you throw the pandemic on top of that. And for some, it has led to a sense of kind of fight or flight. Like they really need to be in a place of trying to survive. And I think for some that pushes them into risky situations related and being survivors of violence or being perpetrators of violence themselves.
This may cross more into a legal question or a law enforcement question, but there's a question here about, the refusal or the decline in charging people with crimes. And does that have an impact on the environment where people are willing to engage because there aren't as many consequences?
I think consistent consequences to behavior, I think about this as a psychologist, right, are important. And I think that consistency in that is, like I said, very important. I also think that when we have individuals who do not feel safe in their neighborhoods, that has an impact on health for those individuals as well, and their mental well-being, their physical well-being, because they're constantly experiencing stress. And so safety in communities and feeling as though one can maneuver in their communities without risk of their own life or the life of their loved ones is extremely important.
Yeah. Other thoughts, Dr. Raymond or Dr. Cassini, that you have on this?
Well, first of all, I just want to say how much I admire Terri and the work that she does. I think you can see that she's genuine and she really knows the business. And she's also doing it the right way through partnerships, through taking a long view about how to change culture and eliminate some of the underlying root causes of violence. Very, very important to do that. And, Tim, the business community also can be great partners. So when you talked about Thrive On, we're really hoping that we can find ways to invest in meaningful ways in neighborhoods that have potential and a good history, but are currently under-resourced. And so we hope to inspire others to do the same.
Great. In a minute or two we have remaining, Dr. Raymond, I'd be remiss if I didn't come back and ask you a little bit about your thoughts today on where we sit with COVID and just look forward a little bit. It's been a long time since we've talked about that. Clearly, it's still impacting the community. I have a sense, anecdotally, I run into more people now that have been exposed than it seems early on. So I really would appreciate your thoughts on where we sit today and just looking ahead.
Thanks, Tim. Well, we're better off now than we have been through most of the pandemic. the ability of us to rapidly provide oral medications to treat diseases early has been a game changer for us. The vaccines have given us a durable community immunity that's been very helpful. Some minor reduction in transmissions, but major impacts on severe disease, positive impacts. We're also showing the accumulation of previous infections provides some immunity as well that has put us in a much better place. So our hospitalizations are fairly stable between 400 to 500 people per day in Wisconsin. That's less than 20% of where we were during several peaks. And many of those people are hospitalized with COVID and not because of COVID. So it's a complicating factor, but it's not the primary cause for hospitalizations. Deaths also are down, but they're still about 5 times the death rate that we would expect from a bad flu pandemic. So, we still have some work to do. Going forward, it really depends. If people are fatigued and won't get these bivalent boosters, if they are casual about their approach to COVID-19, we may have surges. If we have a mutant that fundamentally changes the ability of the virus to cause severe disease, it could cause a problem for us. But I truly believe right now we are learning how to live with it. People are resuming business and the normal activities of life. And we have a toolbox that has some pretty effective tools in it that we didn't have even a year ago.
Always hard to give general medical advice, but the advice would be, as people look out here and we get the new variants and the new boosters, is to go ahead and get boosted.
Yes, Tim, and like most experts have been saying, at least for the last year or two, we probably will be recommended to have annual boosters. And like influenza, they will be tailored to the strains of COVID-19 that are most likely to be circulating at the time. This isn't new. This isn't a transformational concept. We do this every single year with influenza. We can do the same thing for COVID.
Yeah. I see here, maybe I just got one last question up here. Okay, well, we always trip a trigger with this topic. Why do we insist on using the word vaccine with respect to the shots being provided? Vaccines prevent a person from getting the disease. These shots clearly do not do that. Thus, are they not truly vaccines?
With all due respect, they do reduce transmission. Despite what you may read on social media, there's still about a 50% reduction in transmission, even with these highly transmissible variants. They're called vaccines because that's what they are. Vaccines can prevent disease, but the major purpose of vaccines is to reduce the severity of disease. And these vaccines that are available to us in many ways have done a better job of reducing disease severity than pretty much any other vaccine that we've really ever been able to distribute at this scale.
Right. Well, Dr. Raymond, always a pleasure. Dr. Cassini, very nice to meet you, and really appreciate the expertise and insights you bring to a really challenging problem for this community. And another great example, I think, of the breadth and depth of the rich resources that are with us here at the Medical College.